We'll be completing the 7 Functional Movement Screen Assessment. FMS is an innovative system used to evaluate movement pattern quality for clients and athletes, and it consists of a series of simple tests with simple grading. These movement patterns require a balance of mobility and stability. This is the deep squat. It is used to assess bilateral, symmetrical, and functional mobility of the hips, knees, and ankles. The ability to perform the deep squat requires appropriate pelvic rhythm, close kinetic chain, dorsiflexion of the ankles, and flexion of the knees and hips, and extension of the thoracic spine, as well as flexion and abduction of the shoulders. The hurdle step assesses bilateral functional mobility and stability of the hips, knees, and ankles. Performing the hurdle step requires stance leg stability of the ankle, knee, and hip, as well as maximal closed kinetic chain extension of the hip. The subject may also display adequate balance because the test imposes a need for dynamic stability. Next, the inline lunge. This test attempts to place the body in a position that will focus on stresses as simulated during rotational, decelerating, and lateral type movements. It requires a step leg mobility of the hip, ankle dorsiflexion, and rectus femoris flexibility, and display adequate stability due to the rotational stresses. The ability to perform the shoulder mobility test requires shoulder mobility in a combination of motions including abduction, extension, rotation, flexion, extension, and abduction, internal rotation. It also requires scapular and thoracic spine mobility. And each movement is scored 1 to 3. 3 given that the movement is completed without any compensations. 2 uses some compensation, and 1 uses compensation but still cannot perform the movement. The active straight leg tests the ability to dissociate the lower extremity while maintaining stability of the torso, and the subject is required to demonstrate adequate hip mobility of the opposite leg as well as the lower abdominal stability. Next, the trunk stability push-up tests the ability to stabilize the spine in the anterior and posterior plane during a closed chain upper body movement. It assesses trunk stability in the sagittal plane while symmetrical upper body extremity motion is performed. The ability to perform the trunk stability push-up requires symmetric trunk stability in the sagittal plane during a symmetric upper body extremity movement. And this test requires a spinal extension clearing test and is cleared by performing a press up in the push-up position. If there's pain associated with the motion, then the individual does receive needs more evaluation. And the client will receive a score of 0 if there's pain. If not, it'll be scored 1 to 3. Next, the ability to perform the rotator stability test requires asymmetric trunk stability in both sagittal and transverse planes during asymmetric upper body and lower extremity movement. If the trunk does not have adequate stability during these activities, kinetic energy will be dispersed, leading to poor performance as well as increased potential for injury. This test as well requires a spinal flexion clearing test, which looks as the following.